I'm Rosalie Schaefer, and on behalf of the League of Women Voters of Manatee County, I welcome you to our hot topic today. First, I want to thank the hospital for making their auditorium available to us. We usually hold our hot topics at the Bradenton Women's Club, but I'm sure you all have read about what happened to them during the hurricane. So we're hoping for a speedy repair of that facility, and we will be returning there in January. Today, we're going to talk about one of the most important and perplexing issues for our country, healthcare reform. We have one of the most advanced health technologies in the world. It's just how to provide and pay for it that seems to have us stumped. First, a global perspective. The U.S. spends twice as much on health care as the average developed nation, amounting to, hold on to your hats, $1 trillion of the federal budget. Yet we only place 27th compared to these other developed nations as far as life expectancy. How do we fix this? Two bills that would have caused many Americans to lose their health coverage were not successful. But there are a lot more bills and ideas out there. We just have to find one that will work. We are pleased to have with us today 4 speakers on these issues, giving us their perspectives. Kevin DeLallo of the Manatee Memorial Health System, CEO. Victoria Kasdan, Executive Director of We Care Manatee, which provides health services to low-income individuals without insurance. And Gene Strassner of the National Health Insurance Agencies, and his associate, Rick Bennett of Florida Blue. We're very pleased to have all of them with us today. Following their presentation, we will have questions from the audience. And we will pass a microphone around for that. Also, due to the limited time to ask questions, you may want to keep any commentary to a minimum. Okay, we're ready to start with Mr. DeLallo.
So again, welcome to Manatee Memorial Hospital. And I'm going to give you kind of a different perspective of what's happening in healthcare today, moving a little forward, at least what Manatee does, and then how we can move forward, going forward with really some of the issues that are occurring within healthcare today. Let me see if that works. If not, then I'll go here. Okay. Just brief overview of the Manatee healthcare system. We have 2 hospitals and what we call independent physician management. Independent physician management is our primary care, cardiology, general surgery. It also includes our diagnostic centers, our urgent care centers, and our 2 hospitals, which are Lakewood Ranch Medical Center, located in Lakewood Ranch, 120 beds, and Manatee Memorial Hospital, which is 295 beds, also including all the services that are listed on there. The values of our hospital, obviously our service excellence, our continuous improvement and measurables, our employee development. We employ over 2,000 employees in our market. Our employee development, our ethical and fair treatment of all, our teamwork, compassion, and our innovation to service delivery. And of course, we want to be the first in Florida of caring professionals and quality healthcare service. Our mission is to provide quality healthcare services that patients, physicians, purchasers, employers, and investors come to us for and look for results. So go through some of the long history. I mean, Medicare starts back in 1965, but Medicare has a long history of what's happened in how it's evolved in the last, say, 15 years. And if you go back to 2003, and the colors here, one indicates, the dark purple indicates physicians, the light blue indicates hospitals, and everyone says there's no change going on in healthcare. You know, we're still working with Medicare initiatives back from the 1960s and 70s. These are just in the last 15 years of what's happened in healthcare, of the inpatient data reporting, the demo projects that have happened in 2003, 2004, some of the physician group practices that they demoed, some of the physician quality reporting initiatives that they put on physicians to get extra bonuses if they met certain quality initiatives throughout the years. Some of the outpatient penalties, that if you did things on the inpatient side and you didn't do them on the outpatient side, there were requirements for that and there were penalties for that. If you go on to 2011, they started something called the PQRI, which is the Physician Quality Reporting Initiative, where physicians had to report certain quality, and if they reported that certain quality and met certain metrics, they would get certain bonuses. They continued on in 2013. We started some bundle payments. Bundle payments meaning that they would bundle different initiatives throughout the hospital. So in other words, if you were having a hip replacement, they would bundle all the hip replacements under one payment and then have the hospital or the physician spread those payments out. So instead of paying the physician in the hospital and the skilled nursing facility, they came up with bundle payments. And that initiative piloted in 2013 and continues today, where we do have some bundling that's happening throughout the hospital and throughout different systems. We went into value-based purchasing, which meant that if there were certain metrics that you met, that you would get an additional bonus on some of those value-based purchasing, and that continues. And you can see all the way to 2018, we continued some of the hospital requirements. The question mark in 2018 is very much a question mark. But there's no telling where hospitals and healthcare is going to go at this point. There's just so much division in Washington right now. I've said this many times. The healthcare we get is going to be depending on the party that's in power. And the party in power will direct the healthcare we get at this point, especially from Medicare and other governmental payers. You can see in 2011, we had performance periods. 2013, we actually got into the hospital value-based purchasing. We actually looked at readmission demonstrations. We got into what they call the HAC, which is the hospital-acquired conditions. So the hospital-acquired conditions were things that happened within the hospital that you would be penalized for or get a bonus for. And they continued the mandatory bundling payments, the readmission projects, and these projects continue now into 2017, 2018, and will continue throughout hospitals and with physicians as well. And you can see that they continue to impact hospitals and they continue to impact physician practices. So as they continue to enact different legislation in Washington and at the state level, it continues to impact how hospitals are reimbursed and how we take care of different patients that come to our hospital. Hospitals that run emergency rooms have to take care of patients, all patients that come to our emergency rooms. Manatee Memorial is the safety net hospital in this community, and we work very well with many agencies in this, and I see Victoria in the back of the room. We work with WeCare very closely in our community to take care of the patients that come to our hospital. So a few other considerations. So everybody thinks that it's just hospitals. Okay, just hospitals. So I'll go through a couple of the other issues there. These are other issues that affect hospitals. Value-based purchasing, consolidations. But there's really the two issues that I wanted to bring up are as far as healthcare reform, on how policies continue to increase, and some of the rising costs of health and premiums that I think are something that people are now struggling with, and we're trying to figure out how to come up with that. We're seeing that healthcare reform is really not improving some of the quality, because we still see United States not improving mortality rates as quickly as some other nations throughout the world. No change in this. Pretty much the prevalence of heart disease is the #1 major diseases of mortality in the United States, followed by cancer, Alzheimer's disease, and diabetes. And some of the issues, there's really 3 issues. #1 is we're all getting older. The population of 65 and older are growing at an exponential rate. The senior explosion is happening, and as we see the senior explosion from 2000 to 2025, 10,000 people a day. Think about that, 10,000 people a day. So 2 Lakewood ranches every day turn 65 in the United States. So we continue to show how that increases, and the population continues to increase. So that is draining the system, the healthcare system. The baby boomers were from 1946 to 1964, and they continue to grow, and they continue, not only are they more involved with the healthcare system, but they are also more involved, and give me 1 second, I'll finish this up. And I just want to get to the last issue is, how's the diet going? So if you start looking at health insurance, you look at the senior explosion, the one issue that we're really not addressing as much as we should is obviously the obesity problem in the United States. It's a huge issue. It continues to grow and will continue to grow, as you can see. And if we don't get a handle on the obesity problem, actually one of these are my cats, we will find that this is going to be a major problem in the United States. So I'll stop there, and then I'll bring up our next visitor. Thank you very much.
Okay. I'm Victoria Kasdan, Executive Director at We Care Manatee. The information with regards to the bio was in the announcement. My background is I'm originally from Chicago. I'm a registered nurse. I'm a licensed insurance agent. I've been with We Care Manatee for about 2 years. And I've been a Florida resident in Manatee County for about 4 years. So what I'm going to talk about very briefly is the We Care as it exists right now. In case you're not familiar with our organization, a little bit about the current state of the union with regards to health care, what the bills are all about, and who's winning, who's losing, had the proposed bills gone through. The 2 handouts that you have are a summary of the 3 bills: the House bill, the Senate bill, and the Graham-Cassidy bill presented by Lindsey Graham of South Carolina and Dr. Bill Cassidy from Louisiana. We Care Manatee was started in 1999 by a group of physician specialists who saw that they were seeing patients in the emergency room and they were not seeing those patients for follow-up visits in their offices. The bottom line was they couldn't afford the visit. If you're familiar with specialty care, an average visit with a specialist physician today costs anywhere from $250 to $450 for a 15-minute visit. Not many of us have that as pocket change, and so the patients just weren't coming. What they were doing was visiting Kevin's facilities and coming in through the emergency room for their primary care services, for their urgent care services, and occasionally for their emergency services. That's a pretty costly way to get health care. And so our mission is to facilitate medical care for low-income, uninsured residents of Manatee County. Our vision is to make this a healthier community where people have access, and access is the important word, access to health care regardless of their ability to pay. We have a 17-member board. About a third of those are physicians. The others are community leaders within Manatee County. We also have a very small staff that does a lot of work. There are 2 full-time employees, including myself, and a part-time bilingual employee. What we do in terms of eligibility for We Care, we provide access to the specialty care physicians. When you are eligible for a full calendar year to the specific physician that we refer you to. You have to prove or confirm you are uninsured. You live in Manatee County, you're an adult, age 18 to 64. Those ages imply that if you're under 18 and you have this condition and you're uninsured, you're eligible for Florida Kid Care, or CHIP, And if you are over 64, hopefully you are eligible for Medicare. The 4 programs that we have are specialty physicians, pharmaceutical assistants, breast health and wellness, and a small primary care facility. Our primary care is not intended to be a medical home, to be a regular doctor's office that you visit over and over again. It is primarily intended to assist and facilitate addressing your medical needs and getting you to the appropriate specialist. Our pharmaceutical assistance program does not provide birth control. We do not provide narcotics except under special conditions. We do not provide antipsychotics. There are other organizations that do provide that, and we do refer to those other organizations if needed. Our breast health programs, we provide screening mammograms, diagnostic mammograms, breast MRI, breast ultrasound, biopsy. And if the patient is diagnosed with positive breast cancer, they can see a surgical physician, they can see a radiation oncologist and a medical oncologist, all for free. In the last fiscal year, we're on the same fiscal year as the county, which goes from October 1st to September 30th. We served over 1,000 patients in Manatee County. Our doctors donated over $1 million in care during that time frame, and collectively, since our inception, they have donated $7 million. I think I need to underscore, and I did, that this service, the medical services, are free to all patients that are eligible, and in many instances, they are provided by volunteer physicians. These are the same physicians that insured people go to. These are doctors that our patients frequently know and they trust. And when they see one of our eligible patients, they are seeing that patient at no cost. We are delighted to have those Good Samaritans right here in Manatee County. Also, I wanted to point out, we do not have any earned income. We Care exists because of grants, foundations, and proceeds from fundraisers. So our organization is always doing 2 things: trying to recruit doctors and trying to raise money. Health insurance. I'm not going to go over this slide, but it's complicated. One of the things that you learn in debate classes is if you can't clearly communicate, confuse. That's pretty much how you sum up health insurance. Key provisions. To understand the bills, you have to understand what the bills are about and what they're trying to change or address and why there are so many questions and concerns. These are some of the key provisions of the Affordable Care Act, sometimes referred to as Obamacare. We did up to age 26 for dependents. We did guaranteed issue regardless of how sick or healthy you are able to renew your health insurance. Prior to this, people could be denied health insurance by an insurance company. No discrimination based on health status or gender. There was a discrimination status for women. Since I'm speaking to the League of Women Voters, there was frequently a charge of 57% more for women's health insurance, same age, okay, because women use health care more and reproductive. Okay. But men are making the laws. Elimination of annual and lifetime coverage for essential health benefits. Sometimes in the past, there were $1 million caps for certain, you couldn't use more than $1 million, so on and so forth for different things, depending on the condition. It got rid of the pre-existing. That seems to be a big issue in the current legislation. It also indicated that there were prohibits. You couldn't do exclusions for clinical trials. There are ways to get exceptions for that. And then I'm not sure if you're familiar with the medical loss ratio. This was put in place to ensure that health insurance companies, when they accepted that premium, that at least 80% of it was actually being spent on the delivery of health care. Okay. The 10 essential health benefits, these are also up for grabs with regards to new bills. And so I'm not going to go over those, but these are the things that are in jeopardy as we look at new legislation. As I mentioned, these are some of the things that have impacted women that were a benefit to women when the Affordable Care Act went into place. whether it's pre-existing, gender bias, contraceptives, preventive services, maternity care, or others. Medicaid expansion. I'm not going to go over this, but Florida is not a Medicaid expansion state, which means that adults, based on income, may not be eligible for Medicaid up to the 138% federal poverty level. So what we have in Florida is a gap. This is why We Care exists. There are people that make more than they can to qualify for Medicaid and not enough for Obamacare. You have this document in front of you. Frequently, we will talk about the federal poverty level. If you're wanting to understand what it is, the grid explains it by household size. These are the acts. Mental health parity. Many insurance plans in the past did not cover mental health outpatient, inpatient medications. Mental health parity came into place, followed by Obamacare, followed by a House bill, a Senate bill, and the Graham-Cassidy bill. Okay. These were some of the things that we need to take a look at in terms of what's happening with those bills. Small groups, individual groups, Medicaid, power to the states, and variability in cost and coverage. These are the questions, no matter what bill comes up at what time, people are going to ask as it relates to the Affordable Care Act. Okay? And those are listed in the handout that you have. So I'm going to go over those. I'm not going to go over those, but these are the questions to ask no matter what bill comes up. The handouts you have there with regards to that, you can see that when people would ask our legislators, does the bill cover this? You will see frequently in your handout, sort of. Kind of yes, kind of no. And the reason for that is outlined in your handout as to why they were not sure about that. Okay. When you do the math, this is the bottom line. That information is also on your handout. But how much are we spending? How much does it cost? Is it worth what we're giving up to do that? Winners and losers. In the end, the answer to the question that I was asked is We Care loses. With the bills that have been proposed, we lose no matter what. We're serving the poor. We're serving people with pre-existing conditions. We do get some funding from Manatee County, so state governments lose. And of course, we provide some women's health care. And that's it for my presentation. Where are we now? Obamacare is they're trying to usurp Obamacare. Enrollment has been cut in half. There's no marketing. There's limited navigators. There is an executive order that is pending with regards to associations. There is also an opportunity for Medicare for all. And there is health care reform is coming. It's just a matter of what and when and what will it look like. And so my last message to you is that you need to know what's at stake. You need to contact your legislature, let your voice be heard, no matter what your opinion, and by all means, vote.
Thank you.
Good afternoon. I'm Gene Strassner. I'm the local general agent for Florida Blue here in Bradenton. We're the local sales force and also the local representatives and service in the area, and I'm the guy that trains those local people here. My background is I've been involved in the delivery of medical services now my entire life. I grew up in the back seat of an ambulance, and I've been a registered nurse since the 70s, believe it or not. And I will tell you, I love the comments that have been coming out so far, is that healthcare reform is coming. We just don't know where it is. I will go a step further. Healthcare reform is already here, and it's been here as long as we've been alive. It's just changing. Okay? I train young agents, and I tell them there's a couple of things I can promise you. One thing I can promise you is we were not doing it this way 10 years ago. Healthcare delivery was not the same 10 years ago, 20 years ago, 30 years ago, more. I don't want to think more. The next thing I can promise you, it will not look the same 10 years from now. But do we know what that is yet? Not necessarily. We got some ideas. But there's one thing I do want to make sure that everyone understands. No matter what it looks like, we're still here to help. You've got local folks. that are here. We live in the area. My people do not come in for enrollments and leave. Florida Blue has always been dedicated to delivering services to the people of Florida. We take it a step further and go locally. We deliver those services to our neighbors, to our families. So we're not going anywhere. We'll help you figure out what's going on as soon as we know what's going on too. But I'm going to be a little brief, which is very, very difficult for me. People that know me know they should never give me a microphone. Okay? But I'm going to hand over to Rick Bennett, who's going to do most of the heavy lifting today. Rick is with Florida Blue, and he may have some different information, or at least some clearer information for you. But then again, who knows what's coming? Rick?
Thanks. What's the time? What time do I need to? 10 minutes. Okay. So we're not going to get very far in 10 minutes, just because this is a complicated situation, as you probably know. Let me tell you a little bit about kind of where we are. I'm not going to do a presentation because presentation would take a lot longer, and I just kind of want to move you through some highlights. Florida Blue, we have over 5 million people that are insured in the state of Florida, if you include people that are employed out of state and then they have a card with us. So we are the largest by far in the state. We're also only in Florida. That's really important because you are our neighbors. When it comes to the Affordable Care Act, the marketplace, we're the only insurance company that is in all 67 counties, offering all metal levels. That's very important to understand as well, because what happens is if we are so embedded in this, our mission is to just provide better health care and to make sure that our communities and people achieve better health. So that is kind of who we are as a company, and I think that's really important to understand, because what's happening in healthcare, we have been on the front end of this. A lot of healthcare companies were fighting healthcare reform. We did not, and for one reason. We knew it was coming. And you could either spend all of your resources trying to fight something that's coming, or you can decide we're going to jump on board and we're going to try to figure out how to work with it. We are one of the few companies that is actually making money under the Affordable Care Act. There's one main reason for that. We're actually a nonprofit, and I think that's very important to understand. We're not a charitable nonprofit. We're a mutually held company where our members are our owners. Because of that, because we did not have to worry about shareholders, which that's not a bad thing, but the thing that makes it complicated is when you see the medical loss ratio that she showed you, where that's in the individual market, it's an 80-20. So 80% of 80 cents on every dollar has to be spent in the individual and small group markets on medical care, and that leaves you 20%. In large group, which is employers, it's 85%. So 80 to 85 cents has to be spent on health care. That leaves 15 to 20 cents for all administrative costs plus profits. Now, if you start doing the math, if you're expected to deliver to your shareholders 15 to 20% every year, guess what you cannot do? You cannot make that math work. But if your profit margin needs to be about 2 to 3%, because you are not paying those extra people, which again, that is the American system. It's a great system for most things. But whenever we've decided to cap things, it becomes it's an untenable system. It's an unsustainable system. So that's why it works for us, because our profit margin has to be 2 to 3%. So that's just good to kind of understand why these things happen. And the healthcare reform, there's 3 things that they're trying to accomplish here: affordability, access, and quality. Now, if we try to do 2 of those things, it's actually doable very easily. You can do affordable and you can do quality if you take away access. You just charge people more money to get the best health care in the world. It's kind of where we've been somewhat. And if you want to do affordability and you want to do access, you might suffer on quality. A lot of people might say our Medicaid system's kind of in that world right now. But when you're trying to make it affordable, make sure everybody has it, and make sure it's the highest quality, that becomes a very difficult thing to do at the same time. And that's kind of where we are now. We're building a car that we're driving. And we have seen that over the last however many years, that every time we're trying to do something, we can't stop the system and start over. If we could stop everything and start over, we could probably create a better healthcare system. But we cannot do that because we have to provide care, we have to provide insurance, we have to have the hospitals running at full capacity the entire time that we're trying to build something new. And I think that is where a lot of the rub starts happening for a lot of people, is that we're trying to do a lot of things at one time. And if you understand that healthcare reform is something that is happening along the way. And there are things that I think you just saw that have changed since January 1st, 2014, a lot of things changed. That's the day that the ACA became the law of the land. We have essential health benefits now for people that we never had before. And that is very important for a lot of us, because there are things, when my 3 children were born, maternity care was not necessarily part of the game. It is part of it now. You could charge up to 5 times as much for a person who was 64 as you could for a person who was 24. That is not part of the game any longer. So there are some things that we can probably all agree are very good things. Pre-existing conditions are something that we all would probably be thankful for. One of the things that's interesting that when we try to do these things is what we need to understand is there are costs. And one of the costs to having a system that works like this, where we give access to everyone and we make it affordable, is we have to do things like a mandate. Now, nobody likes the idea of a mandate, but the way the system works is with that. And so when people decide, and we as a company kind of understood that ourselves, because as an insurance company, we need to be able to spread the costs around to every single person. We need to make sure that every single person is insured, because then we can share it. And when you share medical costs amongst a larger pool of people, it's much better for every single individual. And so one of the reasons that it's working for us is Florida is the biggest state when it comes to the ACA, and that's really important to understand. We're the 3rd largest state in the nation, but we're the 1st largest when it comes to the ACA. And over 1 million of those people, 1.4 million is what I've seen for the state of Florida, over 1 million of those people are with Florida Blue. So we are completely involved in, affordable health care, in the marketplace, in Obamacare, whatever you want to call it. That's where we are right now. And so when we are trying to help people out, we understand that the changes that are made matter to us and matter to you. And so each time there's a change, we can tell you that we're on the front lines. We're trying to figure out what's going on as much as you are. And there are days, one reason I don't put up presentations during this time of year is literally, I was talking to our policy person on Friday, because in the last few weeks, every time we create a presentation, we have to recreate a presentation, because we can't actually keep up with what's going on with our graphic design department. Our graphic design department is getting ready to do open enrollment. Every single day, something is changing in Washington. So what you need to just understand is there are a lot of things changing. Yes, you're going to ask a question about rates going up this year. There's a reason that rates were going up more than they have in the past. We've had this thing that nobody paid attention to in the past called CSRs, cost saving reductions. These are what happens is, even with the marketplace, you get a subsidy. If you are at a lower income, your subsidy is based upon the federal poverty level where you are. If you hit at right above poverty level to about 125, you are eligible for what's called silver plans. A silver plan is just a plan that is 70% of the money that goes to health care is taken care of by the insurance company. 30% is taken care of you. Just basic kind of understanding of that. But there's these specific plans that if you are between 100% federal poverty level and 125, you get basically cost-saving reductions. It's basically extra money to make sure that you can afford to have health care. Well, a few years ago, it was decided that these were not necessarily constitutional. So what happened under the previous administration, they still were able to fund those. And then the new administration is deciding on a kind of a monthly basis whether they're going to continue to fund those. And the state of Florida decided to ask us, when you decide on your rates this year, do not plan on getting those. And so we had to plan for not having this extra amount of money. The good thing for most consumers is wherever they are on the federal poverty level, their subsidy is going to rise with the premium increase. So for most people, it's not going to impact them. But it is going to impact a few people. Right now, we're looking at about 7% of Floridians that have insurance with us that we believe this is going to impact. Ends up being about 66,000 people in the state of Florida. Not small change. And we have to figure out a way to make sure that we get with agents and our retail centers to make sure that we get those people the right plan so that they do not suffer in the process. And so that's one of the things that I really want to let you know of kind of the landscape right now. There are changes. It was mentioned that the administration right now is planning to do some executive orders, and those are going to change and impact things really quickly. But what I can tell you is the insurance industry, although we're seen as the people who are, depending on your point of view, the good guys or the bad guys, the reason that people get frustrated with us before they get frustrated with anybody else is because we're the ones you pay, and we're the ones who decide on things for you. But understand, because of that, we are trying to do this the right way, and we are trying to be with you and advocate for you. And if you've watched what comes out of Washington, you know, we are trying to stand on the right side of a lot of these issues. Sometimes we're not saying much about these issues because we literally have no idea what it's going to look like, and they've given us very little information to play with, and so we're kind of shooting in the dark some of those times. We would love to not be shooting in the dark, but that's kind of where we are as an industry right now because of where we are in Washington. As was said, that it's kind of a political football right now, and depending on who's in charge, they're going to throw it this way or they're going to throw it that way, and we're just trying to figure out how to make sure, like everybody here, every hospital and every physician is trying to figure out how to make sure that every single person has health care. Places like WeCare are trying to make sure that there is no gap where people are not provided for. And insurance companies are trying to make sure that every single person in our country, and for us in Florida, is provided with insurance. And we are all trying to do this in the midst of some really complicated times. And so, thank you.
Okay, the question was, why is WeCare not covering antipsychotic medication? We do not cover antipsychotic medication because, for a couple of reasons. One, we do not have a psychiatrist specialist as volunteers, and many of the antipsychotic medications require follow-up with the appropriate clinicians. So we are not able to provide that particular service. Many of those medications are also prescribed by psychiatrists. So when we have a patient that needs that type of medical care and or that type of pharmaceutical assistance, we do refer them to Centerstone and or Manatee Glens. So it's not that the patient is not covered or that's not considered part of their care. It's just that we need to get them to the type of specialist that can address it.
Some of the bills I looked at were things that were single-payer proposals. And I was wondering how you all feel about that. One was called Medicare for All, and another one would expand the federal employees' health benefit to all. So I was wondering how you all, what you all think of those.
What I would say is, within any company, you're going to have a lot of opinions on any of these issues. And so we don't have an official stance on a lot of these things. What we are trying to do is make sure that whatever the law of the land becomes, that we are ready for it. Now, Medicare for All, now the two of the things, I'd say the problem with any of the things that are happening is a lot of these new things are not addressing necessarily the costs. And so the cost of medical care is what really matters. And so whether we have the Affordable Care Act the way it is now, another plan, or Medicare for All, if we're not addressing the costs, it's not going to probably make a lot of difference for anybody. Now, when it comes to Medicare, what Florida Blue has said is whatever happens, we are going to make sure that we're on the front of it, and we're going to try to figure out how we can make money off of it. Let's just be honest. That's what we're going to try to do. And so we are not supporters of any specific legislation. We can say that companies have, within the Medicare world, figured out how to make a profit with that payer, because it's still a multi-payer system. A single-payer system versus a multi-payer system, again, we're worried more about the costs, but we understand also that when the world changes, we have to be ready for it. So we have actually taken no stances on any of these type of laws. What we have said is that the present law is flawed, but we would like to work within the present law to make sure that it becomes a better version of itself as opposed to repealing it and start over. We do not believe as a company that that is where we need to go. What we need to do is figure out how to fix what we have now. And we have people in Washington really trying to make sure that we can help fix some of those things. So that's probably, move back that one. All right. Well, I try not to speak ill of any of the other companies, so I would probably try to say kind of an innocuous statement on them. What I will tell you is that when it comes to Washington, there are different associations. The Blue Cross Blue Shield Association of America has lobbyists. Florida Blue actually has its own lobbyist. And then the healthcare industry itself has a set of lobbyists. Sometimes we are in agreement. Sometimes we're in alignment. Sometimes we are not. That's why we have our own, because we are not going to always just assume that somebody who's speaking for the industry is speaking for us. And you'll see that a lot with sometimes hospitals have the same kind of, there are associations of all hospitals that are up in Washington, but still a smart hospital system is going to make sure that they have their own, to make sure that they're taking care of their patients, especially because we're a Florida company. We have very specific things that matter to us because we have an older population than some other places. We have a very large population. We have people that are not necessarily from our state. So we have some very specific things that happen in Florida from a healthcare standpoint that we need to make sure that we have people in DC talking about, because we can't just assume that all healthcare for the United States, all of their efforts are going to speak for the population of Florida. Because again, we care about what happens in the other 49 states. But we are committed 100% to what happens to Floridians. So it's a very different kind of thing. If you are in 50 states, you have a different set of priorities. And if you're on Wall Street, then we do. I'm not going to speak good or bad about them. We just have our set of priorities. So.
Okay, I'd like to answer that question as well as the earlier question that was asked with regards to Medicare for All. So let me start with the Medicare for All question. Senator Bernie Sanders' Medicare for All is a very good bill. However, I think as the other gentleman alluded, it does not cover everything. His plan right now is that that we would lower Medicare to 55 immediately. And then for year 1. Year 2, it would go to 45. Year 3, it would go to 35. And by year 4, it would be truly Medicare for all. His proposal on how that would be paid for is an additional 7.5% for employers in terms of a tax, an additional 4% for the individual in terms of a tax, and additional taxes for the wealthy. Even with that plan, in terms of age phase in and in terms of taxes, it would still not be enough money for his proposed Medicare for all. So it still would need some additional work. With regards to the question with regards to uninsured, yes, our young people think they are superheroes and that they will never be injured. But the minute that they fall and break a hip or break a leg, or they get diagnosed with one condition or another, they frequently are seeking We Care, Turning Points, Manatee County Rural Health Service systems. These are systems that either provide free services or services at a sliding scale. My nephew is 27 years old. He doesn't like, he's a staunch Republican. We still love him, but he's a staunch Republican, and he says, Aunt Vicki, why do I don't have any children, I'm not married, why should I pay for maternity care? And it's a challenge because he just passed the bar exam and he's a lawyer and he likes to argue, but it's a challenge to explain what the gentleman said. Insurance means you have to spread the risk, okay? You have to spread the risk. We have not convinced our healthy young people to come in and spread the risk. And then when they need something, there's a challenge with that. But they have to come in and spread the risk. My response to him was, Daniel, you're not married, you don't have any children, okay? However, you're complaining you don't want to pay for the health care of maternity, all right? So a single mother comes in to have a baby. She comes into Manatee Memorial. That's probably anywhere from $5,000 to $8,000 for a normal delivery. Okay? Didn't have insurance. We all paid for that. And now we're going to pay for that baby, likely, unless the mother gets insurance through an employer or some other way. We're also going to continue paying for that baby, not just that delivery, but potentially for that baby from birth to age 18. So pay now, pay later, whatever. There are opportunities for that. So as you're having discussions with people like my nephew Daniel, you might want to mention that.
When you look at a hip surgery, most people think that all the costs are in the hospital. So, and people focus on that. But the truth of the matter is about 40% of the cost of a hip surgery is actually in the hospital. 60% of it is on the post-acute side. And that's taking care of you post-op, either in a skilled nursing facility, some type of nursing facility that you are after your discharge. So a typical hip surgery may be 3 to 4 days in a hospital. And then the recovery of that could be 6 weeks, depending on what kind of support you have at home. It could take you 2 or 3 weeks before you get back home. You have to be able to get up, feed yourself, go to the refrigerator, get in the shower. So you have to have enough support to do that. That cost, they combine all that and they call it bundling. So if the physician or the hospital can control that bundling, say it costs $10,000 to have a hip surgery, if the physician and the hospital then can come together and figure out how to get the lowest implant for the best quality, the lowest length of stay, to move the patient out of the hospital, the lowest post-op care, and then hopefully those initiatives would help in reducing cost and increasing quality. So there's a lot of quality metrics that are attached to those bundles. And we have seen some increase in quality on those bundles. We've seen some decrease in cost. But not as much as you may think. And a lot of hospitals have gone away from the bundling. We still have a bundling project here at Manatee Memorial. We have a bundling project with Coastal Orthopedics, of which we partner up with them on hip and knee bundling. And we watch our quality very closely to make sure the bundles are not approved by Medicare unless you hit certain quality initiatives in those bundles. It's just not saving money. So it's a twofold. It's quality and it is also lower cost. And obviously Medicare sees this. If you hit the quality initiatives and you hit the cost initiatives, then Medicare will share some of that savings with you, and that's the incentive to move forward. As far as how much quality has improved, it's tough to say at this point, but I can see more and more people getting out of the quality side of the bundling and get more into what they call the ACO, which is the Accountable Care Organization, and you see more physicians and hospitals getting into that. And that is also a Medicare shared savings program that many hospitals and physicians are now involved in.
They've done a wonderful job. We've had some excellent speakers today. If you'll give them all a big hand. Our next talk will be on Monday, November 13th, and it will be on the topic of self-protection in the digital age. We will have law enforcement speakers tell us how we can avoid being hacked, scammed, spoofed, having our identity stolen. And that one will be held at Central Library from 12 noon to 1 p.m. We hope you can make that. We also hope to be back in the Bradenton Women's Club in January. As you know, their building was very badly damaged, and they would appreciate any donations you would care to give them to help restore their building. And you can find more on that at BradentonWomen'sClub.com. We thank METV for taping this program, and they will be replaying it on their station and on their website with their YouTube link. For the TV schedule or to watch our program online, go on to www.metvweb.com. And we also encourage you to join our league or sign some of the petitions on our table and help yourself to some water and cookies. Okay, thank you all for coming today, and thanks again to the hospital for allowing the use of their auditorium. I think we learned a lot today.